small part in the brain. Now, you might ask yourself, what is the function of these two hormones? We shall begin with FSH. When FSH has been produced, it travels in the bloodstream, in the blood of a man, and then it goes to the testes. Specifically, the testes or testicles, that's where the whole process of sperm production takes place. Specifically, the area where the sperms are produced is in a small part in the testes known as the seminiferous tubules. The cells which deal with this whole process of sperm production are known as the Sertoli cells. So the Sertoli cells respond to the effects of the FSH hormone that came from the brain. Now, for normal sperm production, FSH has to come in and then bring about this whole process of sperm production. And then, of course, there's going to be another hormone that is going to be produced. I've talked about it. It's known as the luteinizing hormone. When it reaches a man's testes, specifically, it acts on the cells known as the Leydig cells, causing or leading to the production of more testosterone. Ideally, in a man, testosterone is produced normally in the Leydig cells, special cells in your testes, or your testicles. If you go ahead and then you consider starting, or you go ahead and you start on replacing the testosterone, also known as testosterone replacement therapy, whereby you could actually get injections of testosterone. These could actually be prescribed to you, given to you by your doctor. The effects that are going to happen are that there's going to be changes that will take place in the centers where FSH and LH is produced. Remember, I was saying in the beginning that the brain specifically sends FSH and LH to your testicles as a man, and then FSH and LH will do dysfunction, will carry out this function of sperm production, and then of course maintain your testosterone levels. Okay, if you go ahead and then you get sources of testosterone from outside, we call these exogenous sources of testosterone, injections of testosterone. It means that the artificial testosterone, the synthetic testosterone you are injecting yourself with, could actually tell your body, tell your brain, and then your brain will be able to sense that, you know what, there's more testosterone coming in from the outside. Now, when the brain senses that there's lots of testosterone coming in from the outside, the brain will actually cause FSH and LH hormone to actually reduce. It will stop the production of FSH and LH in your body. Now, when FSH and LH has been stopped,